Good afternoon. Welcome. Hi, everyone. Thank you for joining us. Good afternoon. Happy to see everyone on this bright Tuesday. Thank you for joining. We will get started in just a few moments. And in the meantime, if you'd like to introduce yourself in the chat, please take a moment to do so. We'd love to get to know who joined us today. And good afternoon. Just going to allow a couple minutes to have people trickle in, and then I'll get started with my remarks. Good afternoon, everyone. Welcome. If you would like to, please introduce yourself in the chat. Love to hear where you're coming from and who's joining us. Good afternoon. Hello, welcome. We'll be getting started in just a moment. Right. And so, in the interest of time, I'll go ahead and start with my remarks. Just with a short introduction. So, I'm Shelby and I'm the event coordinator at Voice, which is an organization that advocates for quality care options for residents of long term care facilities and older adults in the greater St. Louis and Northeast Missouri regions. And I'm honored to be hosting today's conversation on driving yourself lonely, which is the topic of loneliness and the lack of connection in older adults and how transportation resources play a large part in that. So this conversation will be led by Margi Valleroy from Aging Ahead and Michele Prevedel from the Visiting Nurses Association from the Greater St. Louis. We are so happy that they could join us and lead this conversation today. So before we get to the presentation, I just have a few updates on our programs here at Voice. So hang in there and we'll begin shortly. So, first, I want to say thank you to our education sponsors because their support allows us to do what we're doing here today and provide many educational opportunities to the greater community. So, thank you to Amon, Gantner, and Capriano, attorneys at law, Your Estate Matters LLC, Enterprise Bank and Trust, Everspring Pharmacy, the FDC Foundation, Infinium Pharmacy, and Quinn Estate and Elder Law. And it is with these sponsors' support that Voice is able to reach our goal of providing education to empower individuals and families about the continuum of care for themselves and their loved ones. We are ecstatic to provide free education to the community and continuing education at a low cost for professionals. And as you can see, we have many topics and opportunities to bring you both in person and online. So we hope that you will join us at a session or two. And we can't forget to mention our wonderful partners from the St. Louis Public and County Libraries to St. Louis University and all the organizations we partner with as for speakers. Thank you. All the information about our presentations, including the times and locations, can be found on our website's event page. And lastly, I want to bring your attention to our annual conference. This year's conference is two half-day conferences, the first of which will be on the morning of April 17th and is an opportunity for community members passionate about long-term care and professionals such as administrators, social workers, directors of nursing, and more to join together and share critical information and best practices. Our goal is to empower and protect older adults by equipping their service providers with insights into their experiences as residents. And we hope that you will join us for a morning of learning and sharing together. And all of the information about our conference is live on our website and linked in these slides, which you will receive after the presentation today. So we hope to see you there. And just a few reminders before I introduce the speakers. There is closed captioning available. And if you'd like to turn it on, hover over the More button on your Zoom control panel and enable the captions. This webinar is being recorded and will be made available to you via email and on our YouTube channel within 7 days. There will be an evaluation that will pop up on your screen at the end of the webinar. So please take the time to let us know your thoughts on today's presentation. We really appreciate your feedback and we'll use it to improve in the future. And as time allows, we will answer your questions. So please put them in the Q&A or the chat and we'll try to answer them either after the webinar. So without further ado, we have Michele Prevedel is the manager of Visiting Nurses Association's Visit a Bit program since 2019. She has over 10 years experience in human services and in the nonprofit sector. She has a bachelor in communications and is passionate about helping older adults in need. We also have Margi Valleroy. She is the Community Options and Services Manager at Aging Ahead, the area agency on aging that serves St. Louis, St. Charles, Jefferson, and Franklin counties. Margie coordinates the development of implementation of various collaborative programs delivered to community members through Aging Ahead's social service, including transportation, family caregiver support, and adult day services. So without further ado, I'll go ahead and let Michele get started.
Hello. Thank you so much for that introduction. Hello, everyone. My name is Michele Prevedel. And as shared, I manage the Visit a Bit program through the Visiting Nurse Association of Greater St. Louis. I have a PowerPoint I'm going to talk through, so bear with me as I share my screen and pull that up. Looks like, let me, let me do a stop sharing really quick. And reshare. We'll try this here, hopefully. Okay, for some reason, this is the very end of the PowerPoint. Let me go all the way back to see if I can, um, so sorry for this technical difficulty. We had gone through all of this. Okay, so I'm just gonna have to, I think, back up from everything, hopefully. So we'll be covering all of this information in just a minute. So sorry. So, yes. This is just a little bit of information about the Visiting Nurse Association. We have been around since 1911, and we have 5 core programs here at the VNA. We have hospice care. We have a program called Advanced Illness Management that started back in 2016. That program is designed to treat seriously and chronically ill individuals in the home. So we have nurse practitioners, physicians going into the home and helping to actively treat individuals that have a history of going in and out of the hospital. So pretty much palliative care. We offer vaccinations and wellness services. We also have private duty services. And last but not least, the Visit a Bit program is what I will be highlighting today. However, I will also be talking overall about loneliness, how to address loneliness, what causes loneliness, some statistics about what loneliness can do to you, and more or less some tips on how to strengthen some of your socialization skills that will ultimately help improve your socialization in general and with other people. So that's essentially what I'll be covering today. A little bit about the Visit a Bit program. It actually started back in 2018, and I've been managing the program since 2019. So I got to see the program before our pandemic and then after the pandemic. So before the pandemic, I think there was a stigma behind loneliness. Some people recognized they were lonely, but they weren't lonely enough to join a program. And essentially, Visit a Bit, it's a free It program. I am the only one managing it, so we do have a number of census that we can allow into the program, but it's a volunteer-based program. We pair volunteers and seniors together, and the volunteers either are calling once a week for about 1 to 2 hours, or they're visiting in person for 1 to 2 hours. And the folks just get together and you get to know one another. We have some pairings that have been together for since the start of the program. We base our pairings on location, hobbies, and interests. Obviously, gender comes into play, and even intergenerational gaps as well. So it's a great program. We're always in need of volunteers, and like I said, we offer even telephone volunteering. It's a really great way, to stay connected and to really kind of combat that loneliness. Okay, so what is loneliness? I'm sure you've heard of loneliness and social isolation. A lot of times those terms are used interchangeably, but they're very different. Visit a Bit, for example, can only address loneliness with it being a non clinical program. And loneliness is going to be more of an emotional um, response within. You can be lonely. You can have a partner and feel lonely. It's a lack of a connection with another individual. You can even, for example, on the PowerPoint, you can be, going to the YMCA every day, kind of saying hi to everybody. But if you don't have that connection with someone, you're going to have that lack of feeling, that openness of loneliness. Isolation, on the other hand, somebody probably was in loneliness a little too long. Maybe they started off lonely, but it kind of was left untreated or unaddressed for too long. And then you almost kind of go into a type of recluse kind of state at that point. And it becomes more of a deeper rooted issue. So, for example, I'll use the Visit a Bit program. I love when a senior will call me themselves and recognize and have the awareness that they're lonely and they want to do something about it. Oftentimes, I'll get a phone call from, an adult parent or adult child from out of state, trying to do something about what they think is their mother or father's loneliness. But come to find out that the person really doesn't want socialization after all, even though they do spend a lot of time by themselves. And those may be more signs of the isolation tendencies. Somebody, they more or less just they may have really short interactions, but they really don't necessarily want to be in social settings. And sometimes depression is rooted to that, or some other more psychological things are going on. But like I mentioned, we can only work with individuals that are lonely. Um, and somebody who is, isolated or going through isolation, very minimal. So they may really never leave their house. They might say hi to their mail carrier or have interaction with their physician once or twice a month, depending on how frequently they go and see their doctor, or just only see the checkout clerk at the grocery store. But they don't really have any kind of ongoing rapport with anybody like that. So those are, some indicators, the kind of the two big categories. And like I said, a lot of the times you may hear social isolation, isolation or loneliness. That is what we're trying to address and what we can address, within this program. So, what can cause loneliness? A lot of stuff can cause loneliness. For example, experiencing a loss in your life or unhealed trauma. Maybe you had a really nice social group at one point in your life, and there was a falling out with somebody. in a social setting, but you never really properly reflected on it. And maybe there's some like unhealed bitterness or something, and that has turned you off from wanting to connect to other people. We will definitely talk about more of this later, but lack of transportation, or even retirement. When you retire, social networks naturally narrow. Eventually, a lot of senior adults, as they continue to age, will stop driving, and then you're home, and you don't have the means to get out and about like you used to, and or if you have technology or that may help you stay connected with people while you're at your home. However, lack of technology, maybe you don't have a smart device or a tablet, or you don't know how to use it. Once again, we have some folks in the program that only have a landline, which is good. However, it's more of a recipe for loneliness because of how our world and society is starting to flourish with technology. In mobility, eventually, if your mobility should change for whatever reason, that leaves you more homebound, versus if you were getting a lot of your socialization out in the society, you're going to be more at home, which is on top of perhaps lack of technology, will definitely can cause loneliness to creep in. Moving to a new area, hearing loss is a big one. Sometimes people, they just don't like hearing aids, and or they don't realize the hearing loss has gotten maybe as severe as it has, and that kind of gets people to go more inward with themselves because of that lack of communication. Language barriers. Say that you move into a new area, and everybody, if you're from a different country, for example, that can be a really big part of loneliness as well. A few other factors would be maybe a divorce or breakup. When somebody gets divorced, you used to have that partner there. Now they're no longer there, and you may now be living alone, which would make you, more susceptible to loneliness to creep in as well. Um, I get this one a lot. People are living longer. People are outliving their friends. Maybe you had a great social network at one point. However, say you have you're living a very healthy lifestyle, which is fantastic, and that could be a reason. Maybe people just didn't live near your friends didn't live near as long as you did. Either chronic health conditions or even maybe some mental health concerns that have changed can also lead to loneliness. So there's a lot of different reasons, and I've read a lot of articles and done a lot of research on loneliness. And it's not just senior adults that are lonely. We even have some volunteers that have joined the program that are trying to also combat their own loneliness by connecting. College students can also be very lonely as well. So it's not just senior adults, but I think on top of sometimes lack of transportation, mobility, and technology, unfortunately, they're a little bit more highlighted population. So, what are some signs of loneliness? Because that's a pretty dense emotion to pinpoint and to recognize. And we may be lonely and not even know it for a little bit. Well, for one, you're going to feel it. However, if you're not sure how to label that emotion, these are some other kind of components that can kind of indicate, hey, I might be feeling lonely. This sounds kind of counterintuitive, but sometimes when when you a lot of the times when you are lonely, you may also have some depression with it. And with the depression, it gets you to kind of push away from people. So you could kind of already be pushing away or even withdrawing from social activities. If you have gone through maybe a higher emotional time in your life, and it's harder for you, or maybe you're in that grieving stage, you may feel like you're having feelings of misunderstood with your current social pool, and people just don't understand you and what's really the point. Um, a lot of times people maybe have the desire for social interactions and connections, but they just don't know how to go about it, especially if you're not fluent with using the internet and kind of looking outside sometimes the box. When it comes to social connections, a lot of the times people are in the same home that they've been in for many, many years, and they have new neighbors and young families. They don't know their neighbors like they used to. And that was a big source of um, socialization at one point in their life. So, how do you connect with a really busy next door neighbor family that's just on the constant go and you don't want to feel like a burden to them, for example? So, those are just some things that can also lead up to that loneliness and making you feel almost trapped at times. Like, what do I do about this? You may have people around, but once again, it's trying to find that connection. um, Somebody who is maybe chronically lonely, when you do get a person with in front of you, for example, you may have a tendency to like overshare a bunch of information or even monopolize a conversation, especially if you're more on the extroverted side. It's almost like a built up energy within, and you have an outlet right now in front of you, and you're just going to share everything. So we'll talk a little bit more on how to polish some of your social skills later, and how to develop and maintain some new, either new social connections that you can develop, or ways to kind of, okay, we got somebody in front of me, but I don't need to tell them everything at this moment. Just becoming more secure within yourself, especially in social matters and social settings, is it's going to be really important. Because if you do overshare or monopolize conversation with other people, it might overwhelm somebody, and they may or may not come back. We don't know, but at the same time, we just want to be making sure that we're socializing for more of a balanced, I guess, scale. For example, we don't want to be, talking for 10 to 15 minutes without hearing from the other person, asking the other person questions, making sure they're doing okay, and hearing more from them. That's really, really important. That can lead to being able to maintain that balance, can also make it difficult to make new social connections. Okay, so I'm sure everybody has kind of heard about how loneliness, there can be some domino effects onto your health if you remain in loneliness, or it goes untreated for too long. Not at all trying to intimidate anybody, but at the same time, these are just some statistics out there. Once again, we're starting with an emotion, but left untreated or unattended will have other effects. For example, loneliness can affect your heart. It can affect your cardiovascular disease, for example, obesity, heart disease, even dementia. So just trying to, stay engaged, as best as you can. It can definitely cause stress in somebody's life, anxiety. It can definitely lower self esteem. And sometimes when people are, feel so alone, like I said, it can lead more to depressing like feelings, which, can coincide with, for example, substance abuse. But essentially, a lot of people have felt lonely, and not just older adults, but essentially 45 have reported feeling lonely. And some of these statistics are from a few years ago. So I'm sure that there's been even more studies since the pandemic, and highlighting on, trying to prevent loneliness from creeping in and affecting your actual physical health and mental health at that. Okay. So, um, oops, sorry. Individuals that have a stronger social bond are more likely to have or to live a little bit longer, essentially, have higher quality of life as well. There's a lot of benefits to having, good, solid social connections. And, maybe if you have outlived, friends or people that you've known a majority part of your life, yeah, you may not you may or may not be able to find as strong of a bond. However, you can at least try, and just know that you're not the only one out there going through this. And it's very important just to try to stay as positive as you can, and also know that socialization, even if it's for a couple of minutes, there are benefits to chatting with someone. Essentially can help promote healthy eating and physical activities and help you maintain even a healthy weight because you're living more of a balanced a balanced life in general. And I think that there's just a lot more awareness at this point, as far as how important social outlets are. Also, having strong social connections can improve your sleep, your well-being, and just overall quality of life. So, how to address loneliness? If it first really starts with yourself, and there is a lot of self reflection that needs to really go into possibly why you're feeling lonely. First, it's important to kind of accept yourself, work on self esteem, make sure you're taking proper self care of yourself, self-compassion. It's important to kind of maybe go deeper on how did I maybe get in this situation to begin with? Everybody's situation is different. But like I mentioned earlier, it's more common than you think. I think a lot of people, when you are by yourself, you're obviously thinking, um, and you just think that you're the only one in this boat. And with us, living in St. Louis, which there are some commuter friendly parts of St. Louis, but the majority, especially like St. Louis County, it's not a very commuter friendly city. So a lot of people are just kind of at home and they're thinking by themselves, but just know that there is a lot of other people at home thinking by themselves too. So it's really important to prioritize social connections, be available to, give the time and attention to your current socialization that you may have. And even if it's, a neighbor down the street you only see a couple times a month, is there a way that you can maybe lengthen that? Could you invite them over? Maybe it's okay to put yourself out there a little bit. And when you're feeling better about yourself, you'll feel more confident about extending social invitations to other people. I think sometimes we get in a place where we are expecting people to call us. The family doesn't call me like they used to or they should, or I have maybe, grandchildren, or maybe you understand everybody is kind of living their own life. It's important not to try not to fall victim to your situation. Because that's going to be harder to kind of get out. Socialization is kind of a give and take. There's times where socialization may fall more in your lap, and I would take advantage of those opportunities, even if you're not really wanting to. I don't think you're going to regret it, as far as there will be kind of an aftermath that you'll feel filled up enough for at least the rest of the day, if not a day or two. So that's kind of how socialization works. Um, and there might be times where you have to extend the invitation out or try to initiate. So that kind of puts you in a vulnerable place, especially if deep down you are fearing rejection. But all you can do is try. And when you do try, a lot of times you'll have more of that self satisfaction. Even if it's a matter now that the weather is really nice and we're in spring, if you even just sit on your porch, people are out walking more. It's okay to wave your hand and say, "Hey, beautiful day." We'll get more into that, but essentially, it starts with what's in your control at this time. And if you do need more of that self help and looking inward, and maybe healing unhealed trauma, that's a big part of it as well. And stepping out of a comfort zone as far as maybe technology, learning technology. And you may never get to a point where you know technology like the back of your hand, but maybe you can learn technology, like you know how to check your emails and send out good emails, or how to attend a Zoom meeting that can be interactive, or something really well. versus not having to master all of technology, essentially. So, once again, and having goals for yourself, like for example, one of the volunteers in the program for Visit a Bit, she was a speech pathologist for senior adults. And one of the goals that she would always pass along is try to talk on the phone for 15 to 20 minutes a day. Like, make that a goal. And maybe you don't have somebody you can talk to for 15 to 20 minutes a day, but if you have a hobby or interest, maybe you can call up a store and see if they carry, I don't know, a certain type of, knitting material or something, or call the library and ask if they have something in stock. Or you can, if there's a will, there's a way. You can kind of be creative, fall back on your own hobbies and interests, and maximize, as many socialization opportunities you get. Um, so some other, for example, these are some things that the Silver Sneakers program, I think through Medicare, is offered. You can look deeper into that, but a lot of them offer free gym memberships. Library has lots of free classes. Grocery stores. Also the biggest key is staying consistent. As we mentioned, you may have a lot of little social interactions where the loneliness may still be there. But you never know when you're going to actually make a friend, at the gym, small talk, and, they'll share a little bit about, their weekend. And then next time you can go in and ask how their event was over the weekend. It's not going to be maybe overnight, but if you are still getting out and about, these are some things, or if you are more homebound, if you have a delivery person that brings your groceries, I don't know if you work with the same person or not, but you also have to be aware of social cues when people do and don't want to talk. And that's just a matter of just kind of strengthening, and for example, when somebody is on a kind of a tight time crunch and they can't just keep talking, it's really important that you can try to respect that. And when the person feels respected, that's good, and that means that you're ending on a good note with them, and there might be more opportunity with that person, for example. But and don't undervalue small talk. It's okay to give somebody a compliment. Oh, I love the shirt. Oh, beautiful day, isn't it? Oh, talk about the weather. That's okay. You have to start somewhere. But essentially seek social groups. For example, Meetup. If you look up that website, they offer a ton of interest groups that are a lot of times just free. And if somebody's meeting at the park and they're going to do a walk, half the time there's 5, 10, 15, 20 people that also show up, depending on your mobility. And they offer a lot of consistent groups almost weekly, so you can get to know people like that. And they also offer a lot of online groups as well. So it's out there. It's a matter of just kind of trying to find the best social outlet for yourself. Um, let's see here. Also, it's really important you don't compare yourself to other people where they are socially. That's not helpful. And everybody is like everything in life, everybody has different cards that they're dealt, and they have to work through different hurdles. And some things are easier than others, and whatnot. But that I have learned, and I've always have passed that advice along. That it's important we don't compare ourselves, and like I said, have goals. A one in-person event a month. If you can't talk on the phone for 15 minutes a day, 2 times a week, try to give somebody a call. If somebody's not calling you back, take that as a social cue. Look for a different outlets. So yeah, these are just some ways and tips and ideas. A couple of I'd like to cover active listening tips. So this is an example from the book "You're Not Listening" by Kate Murphy. I listened to this about a year and a half ago, and these are some things that you can just become a little bit more aware with your one-on-one. Conversations. And you may have excellent listening skills, But sometimes if you're talking with somebody who maybe doesn't have them, give them a little bit of grace. We're all in different boats, and we're all trying, or at least that's what I believe anyway. So, an example of some active listening tips, there's essentially two different types of responses somebody can have. You can have a supportive response. Or something called a shifting response. So, essentially, an example would be my dog got out last week and it took 3 days to find him. A supportive response is staying on that topic. You want to learn more about this dog situation. Oftentimes, people are in the habit of practicing more of the shifting response, where they are interested maybe in the dog situation. However, they're going to pull the topic back onto themselves without maybe even realizing it. So, essentially, a supportive response would be like, "Oh no, where did you finally find him?" So, this encourages the speaker to help that listener gain more understanding and increase when you are really actively listening to somebody, you increase the chances of the brain waves connection between the two individuals, which is building intimacy and that rapport. So these are just examples on how to kind of start up new friendships. For example, you want to really make sure you're listening. A shifting response, on the other hand, is our dog is always digging under the fence and we can't let him out unless he's on a leash. So we went from talking about the first person's dog. Now we're talking about the listener's dog. So this shifts. This is very common. However, these are ways to practice to strengthen your socialization skills. And you're listening for feelings as well as facts when people are sharing information with you. And maybe one interaction you're talking about the other person more. And maybe the next time you can, if you feel like, oh, we're always talking about them and their life, I'd like to talk about myself, we'll go ahead and dedicate one interaction to talking with them. And the next time, attempt to talk a little bit more about yourself. Or, as I mentioned earlier, try to really find a balance between the two individuals and the two parties, for example. So, redirecting conversation tips. Essentially, I'm sure we've all been talking with people, and more of a negative or a venting conversation can come up. It's really important we understand venting, especially if you're in a safe place with a friend or whatnot. However, if you find yourself venting a lot, or you find the other person venting a lot, and that's all the social interactions you're really having with one another, on top of you already have a limited social pool, that's not going to be great. That's not great quality, and you're not going to really be feeling great after that interaction. So, once you kind of recognize, oh boy, we're on a topic, you might even recognize it with yourself. You're like, oh, I shouldn't go down this rabbit hole right now. But essentially, it's really important to try to redirect and to save face, as they say, and do it more indirectly. If you have a lot of confidence or you're real comfortable with the individual, you could say something like, oh, no, can we change the subject or something? But it's a little easier to maybe do that, especially in a newfound friendship or new social setting where you don't really know the person. To more or less do it indirectly, and it's done easier in person. But sometimes, so these are just a couple of tips. I let the person kind of talk 3 to 5 minutes, but it will be harder to get off of that topic if you're now talking 5, 10, or even 15 minutes on something that is maybe not super positive to talk about. So these are also, and this also includes, kind of like complaining about being lonely. It's really important that we really shift the language. I'm seeking more social outlets. I'm looking for new social groups. I'm looking to make new friends versus the constant language is I am lonely. That will kind of keep you more in that current state, more in that victim state. And especially people who are getting out and about more and socializing, and where you just kind of bring up the loneliness all of the time, that think if did we leave on a high note or more of a lower note on the conversation, you always want to try to leave on a higher note. But essentially, during this time, think of something that you can maybe carefully bring up. So in person, you can, toss out a compliment that they're wearing or something, or, oh, I see your new sandals. Those are so cute. I meant to say that earlier. Or if you're somewhere, oh, I like that picture that's hanging near your fireplace. Where did you get that? It is a little bit of a cutoff from the conversation. However, it's more beneficial for both parties. If you're on the phone, you can even try, at least attempt to try to change the conversation. And sometimes you might just have to say, I'm so sorry. Can we talk about something else? But it is important to try to keep a little bit more on the lighter note. And I understand some conversations, just have to be had and whatnot. But if you are just looking for, you're just building up, with a new individual, having more positive conversations and topics to talk about. Okay. Some other really important things that can be extremely important is um, positive reminiscing. Now, there's also negative reminiscing, but essentially, positive reminiscing is when you're talking about past times, good things in your life that have happened. I understand, there could have been a lot of like heartache in your past and whatnot. And I'm not trying to say, oh, don't act like that never happened or whatnot. But at the same time, the positive reminiscing is going to kind of remind your brain of how good it was. And these are some of those strong positive examples of what positive reminiscing can do for you. So if you're talking with someone from the same generation, give or take, you can use opening lines. Hey, remember when? And going down that memory lane. And it can be a lot of fun sometimes talking about the good old days and start laughing and releasing all those feel good, chemicals and whatnot. And in the Visit a Bit program, we have, sometimes we pair a college student with one of the seniors. So there's many intergenerational gaps in there, so if you're talking with somebody from a different generation from yourself, you can say, can you remember when? And if the person doesn't quite remember within the first couple of prompts, it's probably better just to drop it. We don't want anybody to feel bad for not remembering. So don't ever want to push any of that either. But some overall benefits of positive reminiscing, positive emotion, stress reducing, increase the sense of gratitude. You get to cherish those memories. Once again, increasing your self esteem. Um, Improve sleep. So it can be really, really good for your overall well-being. So yeah, that's kind of essentially, and like I said, trying to read people, a little bit the best you can, and it's probably better, a couple 1 or 2 hours if you're socializing. Don't any draw anything out too extensively. And it's okay to put yourself out there, start up conversation and stuff like that. The number one requested resource for the Visit a Bit program is transportation. And we completely understand people wanting to get out and about, just having limited means to do so. So, with that being said, I'm going to go ahead and pass the baton over to Margie so she can explain more about how transportation can kind of tie in with the loneliness. So, thank you.
I'll just chime in to say that we'll take questions at the end. So don't be shy to put those in the chat. We'll keep track of them as Margie gives her portion.
Whoops. Give me just a second here, please. Hopefully you're seeing the correct screen here. Thank you.
Yes.
Well, thank you. And thank you, Michelle. I have to say, I learned a lot listening to your presentation. So I appreciate that. Thank you so much. And thank you all for participating today. It's my pleasure to be with you. And I enjoy talking about the Area Agency on Aging, of course, and certainly transportation is it does tie in very well. And we're happy to be able to provide some transportation services. They don't always look just like this. I don't think too many of the drivers that our participants see are wearing this great shirt, but you never know. I do want to talk a little bit about area agencies on aging. Um, and just if you're not familiar, I hope you are, but if you're not, there is an area agency on aging in every county across the country. In Missouri, there are 10. Aging Ahead, which formerly was Mideast Area Agency on Aging, provides services, as was mentioned earlier, in St. Louis County, St. Charles, Jefferson, and Franklin counties. And the city of St. Louis is provided services by the St. Louis Area Agency on Aging. Agencies came about in 1963 when Congress passed passed legislation which presented the Older Americans Act. And with the Older Americans Act, there are several services that are mandated to be provided by area agencies on aging, and transportation is one of those services. And any service that is provided by an area agency on aging is done so without a cost. We do no means testing, although I will tell you, we may ask a person about their income. And if we do so during an assessment, we're doing that so that we can determine if there are other services that they might be eligible for. Maybe there's something else in the community that we can help them help them benefit from an application, perhaps, or another service that might be helpful to them. So when we talk about the transportation services that are available through Aging Ahead, we're talking about transportation to our nutrition sites, our congregate sites, commonly called senior centers. I have to say, I kind of like the word senior a bit. I actually always use older adults personally, and maybe that's because I passed that eligibility requirement a couple of years ago. But also people who are lonely, certainly a place where we want people to go to socialize, to be with other older adults, and to also enjoy a meal. The meals that are provided at the centers meet a third of the daily requirements for an older adult. So it's a nutritious meal to begin with. Also from the centers, excuse me, we provide home delivered meals or Meals on Wheels, which I'm sure most of you are familiar with. The other types of transportation that we can provide are for medical appointments, for essential shopping. We can provide transportation to food pantries and some limited business trips, like to the DMV for voting. Let's see, there's a couple others. I'm sorry, I can't tell you what those are at this moment. Not because I don't want to, I just can't remember what they are. And I also wanted to let you know, if somebody wants to go to one of our centers, they need to contact the center to start the process for the transportation. If they want to use the transportation to go to one of the other types of appointments, they want to go to a doctor for some kind of a medical test, or go shopping, go to a food pantry, they're going to contact our Community Options and Services Department. And excuse me, just a second. Our Community Options and Services Department, which I have the honor of managing, is made up of social workers. And in our department, we will do an assessment to determine what type of transportation is going to be appropriate. And also if the individual is going to be eligible for our transportation. And basically to be eligible, we want to determine if they are 60 or older, if they have other available transportation services. Do they have transportation from Medicaid? Do they have it through a Medicare Advantage plan? Do they live in a retirement center that has transportation to the grocery store once a week? The services through the Area Agency on Aging, the federal dollars, are dollars of last resort. So we need to use those other dollars first if they're available. It might be that someone can go to the doctor with their insurance, but they can't go to the grocery store with their insurance. So we may pay for one type of service, but not another. Currently, the transportation that we provide in St. Louis County and St. Charles County it's currently being provided through EMT, Express Medical Transporters, and On the Go. And in Jefferson and Franklin County, Oates is the provider for both medical, essential, and also for the centers. And Union Senior Center Transportation goes to Union Senior Center. Um, we go out for bid for all the services that are provided by those that you see listed here for transportation services, as well as some of our other services that we provide every 3 years. And in fact, right now, this month, transportation is being bid on, and then those providers, the contracts can be reissued every year during those 3 years. So if you are a transportation provider and are interested in bidding on our transportation services, now's the time. And that information is available on our website. If you want more information about that, you certainly can give us a call after you take a look at that page on our website, agingahead.org. I also wanted to mention both for the something to do for people to help with loneliness and also as transportation. We do have our choice programs, and those programs are provided at the St. Louis County libraries. And it's basically a really exciting program. We've been doing this for a number of years. And there's a presentation that happens at various locations. Those are all listed on our website. And there's also a meal that happens. And we are able to provide some transportation in limited areas. So within a 7-mile radius of the location for that as well. So when we talk about barriers to transportation, I think that there are many, and you probably have some in mind as well. But certainly there are a lot of people who don't have access to a vehicle, or they just aren't able to drive. Some people who have never driven. Talked to somebody yesterday who has a car sitting in the driveway that is broken down, and it's going to take thousands of dollars to repair, and they just don't have the money. It's just never going to be repaired. People just don't know about resources for transportation. They just can't afford some of the providers that are out there. Somebody mentioned recently to me about navigating public transportation, just didn't know how to do it. And I understand that. I talked about having to transfer between buses, or they could use Call a Ride to get somewhere, but then it wasn't going to take them where they really needed to go. So they were going to have to get off of one vehicle and get on another, and it just wasn't going to work for them. And then physical mobility being a concern. If it was curb-to-curb service, maybe it was coming to their home, but getting off the porch themselves or getting out of their front door themselves was going to be a problem. And so it didn't matter that it came to the curb; they still weren't going to be able to get to the vehicle. And technology, I think Michele talked about that a little bit as well, that being able to use technology to, sometimes we might use Uber ourselves, or our children might use Uber, but if somebody doesn't have a smartphone, they're probably not using Uber. And the implications of not being able to use transportation services can be dire. Certainly, without transportation to the doctor, people's health care can be delayed. They're missing appointments. They're not socializing. So if they're not socializing, we know that can cause loneliness. which can lead to isolation. People aren't seeing them, they're not seeing people. But then when people aren't seeing them either, they're not seeing changes that may be occurring with their health or with whether that's their mental health or their physical health. They're not able perhaps to manage their essential needs. They're not getting their groceries. They're not eating well. They're not taking care of themselves. I took a look at our, when I was preparing this, at our stats for January and just kind of looked at the number of calls that we received. And in our community options and services department, for the month of January, we received about 1,200 calls from the community. And out of those 1,200 calls, 190 were for transportation. I thought that was pretty interesting. And those were calls from people who had never called us about transportation before. They weren't calls from people who were registered already with us wanting a ride. Those were people who didn't know how to get a ride. That's kind of astounding to me. And then in that same month, we provided 2,700 units of transportation. It's a lot of people who need transportation. So really, the need continues, obviously. And I will say, I've pretty much spent my entire career here at the agency. And when I started, the top two needs that we were hearing then were for housing and for transportation. And those are still the top two needs. So I don't know what we do about that. And obviously, we do all know that baby boomers will have been and will continue to be retiring and having the same needs that that people needed 35 years ago. Not quite sure how we meet that need, um, but it will continue, obviously. A couple of things I thought about too when Michelle was talking about people being lonely. I thought about a couple programs that we have going on. We do have a friendly caller program, and if you know people who could benefit from that, we'd like to hear about them. We'd like to try to help connect volunteer callers with them. And we also, what I mentioned, our home delivered meal program, and for quite some time, again, talked about COVID, we really had no choice but to deliver frozen meals across the board. And our centers are working hard to get ramped up with volunteers again to deliver hot meals as much as possible. And that volunteer delivering the hot meal is seeing the person then who's receiving the meal. And that's another contact for that individual. It's a benefit, it's a win-win. The volunteer sees somebody and the recipient is seeing someone. So again, an opportunity for maybe a contact for someone who is lonely and an opportunity for a volunteer to make an impact on someone's day. So I'll throw that little public service announcement out there. So I'm going to leave my information here as well, and certainly open to any questions. And also, I would ask you if any of you, we've been trying to consider developing another program that might impact caregivers and with volunteers, and haven't really come up with that program yet. And I would love to hear any input from you if you have thoughts about ways that people who you're working with you think could benefit from volunteer interactions with them. So you'll have my contact information from Shelby afterwards, and I'd appreciate any thoughts you have about that. Thank you.
Thank you, Margie. Yeah. There is so far one question in the chat, but just want to say that it's all open now. So definitely get those in when we end today. But the first question I have is about to Margie if clients can use transportation to get to the YMCA for exercise or health programs. Transportation via Aging Ahead or Sleigh, I assume.
Unfortunately, Older Americans Act money cannot be used for that. So at this time, no. I'm not going to say that that's never going to be an option because we do look for other funding sources. So I'd kind of say watch this space at this point.
And another a question that I just have is about your choice programs and if you happen to know like about how well attended those are and if people are utilizing the transportation resource for those specifically.
There have been several apartment buildings that have had large groups going to those.
Okay.
Not so much individuals here and there. Although a lot of individuals go to those, but I think they've mostly been taking themselves to that. They've been well attended, like over the years that we've had that. Yeah,
Awesome.
yeah.
I don't currently see any other questions. I know we had someone to ask for the email addresses, which I provided. Oh, let's see, maybe one. So, one for Michelle is there currently a wait list for the Visit a Bit program?
Yes,
I guess
we
it's
do
not
have a yes, we have a wait list, and I should add we onboard folks that are about 65 years and older. We serve St. Louis County, St. Louis City, Jefferson County, and St. Charles County. We unfortunately cannot onboard somebody who has untreated depression or a memory diagnosis. The program is just not designed for that. And somebody, if you are living with someone, like currently, whether it's a spouse or a roommate or a family member or a friend, you would qualify for a phone volunteer. If you live completely alone, then you would likely qualify for um, an in-person volunteer, of course, contingent on the initial home visit. I come over and meet you and everything like that. So yes.
right. And then another question was about if Aging Ahead is available in Jefferson City, which I already know it's not. But Margie, can you uh, discuss about the area agency on aging that is available in Jefferson City?
Yes, there is an area agency on aging there, and I'm going to say it's Aging Best. I'm pretty sure.
Sounds
Um, Elder Care Locator is a nationwide program that would tell you the area agency on aging in any place, any county across the country. And I can tell you their number right now if you'd like to have that. It's 1-800-677-1116.
okay. That was
Or
elder care located.
yes, uh-huh.
Okay, I'm putting that in the chat. Oh well, maybe I'll send it to everyone.
You can also go to the Department of Health and Seniors or Department of Health and Senior Services to get the map of Missouri with all the area agencies on aging, and their phone number would be listed for Jeff City.
And another question is, can someone on Medicaid receive transportation services from Aging Ahead?
Possibly. It depends whether or not their transportation is covered under their Medicaid, because not everybody who has Medicaid has transportation services, but some do. So if they have Medicaid transportation to the doctor, then no. But if they, but we could take them to the grocery store. We could take them to the center. We could take them to a pantry, but not to a medical appointment if it's already covered. We can't supplant other federal funds. So it's the same if they're in a Medicare Advantage plan, because that's also federal funds. Same thing with anybody who's receiving any veteran services. We can't provide the same service that the VA is providing if it's paid for with veterans or with federal funds.
Yeah, but a big part of what you do, correct, is really locating where people have these funds and getting them connected with that so that they're able to get that transportation.
Yeah, we do a lot of yes. Yes, there are other and I'm sorry, I forgot to mention that.
Puzzle pieces.
Yeah, thank you. Yeah, we don't only tell people about what we do. It's our job to know about resources in the community. So, if our transportation is not an option, we're gonna talk about other things. And I didn't talk about that at all, I don't think. But we're gonna go through if you live in Bridgeton, you need to go to the doctor at DePaul, Bridgeton has a van for that, things like that. Uh, yeah, call us if you have any transportation needs. We'll see what we can do to help. Or other needs as well. Even though this presentation was about transportation, our department is that's what we do. Information and assistance is one of the things we do.
Awesome. Well, it looks as if there aren't any more questions in the chat. So I'll just go ahead and share my screen. And so I'll give you guys 25 minutes back to your day today, the first day of spring. So hopefully everyone can get outside and see how lovely it is, even though it's a little cold for that. But we do hope that you found these insights helpful. And of course, these emails are here for you if you have any additional questions that you might not want to ask online today. Um, our next webinar is on April 16th, but we also have some in person sessions. And we just hope to see you soon. And thank you all for joining today.
Yeah.
Thanks again to our speakers as well.
Thank you.
Thank you.
Thank you.
Bye, everyone. Thank you.